Hi, Ring Gibson here. Today we're going to be doing the NG tube insertion checkoff video. So I'm going to start with my colleague. I'm going to check my orders and check my patient's allergies. I'm going to assess the patient and assemble my supplies. I'm going to wash my hands and put on gloves. I'm going to identify myself and identify the patient using two identifiers. I'm going to provide for privacy, and then I'm going to educate, explain, and evaluate. So first, before we begin, I'm going to just ask the patient a couple of questions. I'm going to ask them if they've had any surgeries on the nasal passageway, if they've had any kind of trauma, if they have nosebleeds, or if they have a deviated septum. I'm going to assess their cough and gag reflex as well. And then I'm also going to check their nasal patency, so I'm going to have them close one side and breathe out, and then the other as well. And whichever one is more patent, that's the nostril that I'm going to be inserting the tube down. So I'm going to first check the patency of my tubing, so I'm going to pour some of my solution into my container. Remove that. So I'm going to connect that, and I'm just going to instill some of the solution, make sure that it's coming out of the bottom to make sure that it's patent. So after I've done that, now I'm going to go ahead and measure my tubing.
And then I would just continue to assess the patient anytime we're doing any feeding.
So I'm going to start at the ear, take it to the tip of the nose, and then down to the xiphoid process. And then I'm going to mark that with a piece of tape.
I know we don't pin it, tape it. Tape it to the
Okay.
We don't tape it.
So now I'm ready to insert.
Oh, okay, I was wrong for the video. But I think you can do either.
So before I begin to insert, I'm going to place some lube on my drape or whatever, and I'm going to lay the end of the tubing in the lube. And then I'm also going to have a UAP or someone have a cup of water ready with a straw, because if the patient starts to cough or gag, we're going to have them take sips of water to kind of help alleviate that. So after I have my tube lubed up,
as long as you don't wait until like way after.
I'm going to have the patient tip their head back for initial insertion and then bring it forward chin to chest.
That's cool. This is not actually lube, that's why I like it.
So if the patient starts coughing or gagging, I'm going to use a pin light and check the back of the patient's throat just to make sure it's not coiled up back there. Now with this mannequin, there's a lot of resistance and can't really get it all the way back there, but we would continue advancing the tube until it was where we marked. So I can either hold this with one hand or I could have the UAP hold it, and I'm going to get another piece of tape, and I'm just going to temporarily secure it onto the bridge of the nose. I don't have any medical tape, so this is not really the type of tape that we would be using, but just for temporarily we're just going to put it there on the bridge of the nose. So then we're going to again take this and we're going to aspirate the tubing just to make sure that we're getting some stomach content back, to make sure that it is in the right place. So once we do, we are also going to check correct placement with an X-ray. And after we've done that, then we're going to secure it.
Do we really?
So we would have a piece of medical tape that we split about 5 centimeters down the middle. And we will place it over the bridge of the nose, and then we would wrap it around the tubing on both sides to hold it in place. But since I don't have any medical tape, this doesn't quite work very well. So then after that, I would just make sure that the patient was comfortable and that they didn't need anything, and then I would document my results. Thank you.